Dr. Lee Devaney. He has a PhD in psychology, and he works on the British Red Cross. He is currently working on a research project on community resilience in urban areas, and he will present on his work and identify whether uh, the ways that we can better respond and prevent disaster impact.
Okay, so hello everyone, and thank you for taking the time to come and listen to this part of the talk. I really appreciate it, and thank you very much, Maureen, for what you just presented. It was very interesting. I've taken many notes. What I'm going to talk about is how we designed a community resilience program for on the ground, and more specifically how we applied psychosocial elements into that. We believe that we were fairly confident that what we done with people and how we done it really helped community members to reduce their anxiety, build bonds within their community, and find purpose in the difficult circumstances that they have been through. So I'm going to tell you a little bit more about the broader context of the whole program now, so as you understand where we're coming from. So CRUA stands for Community Resilience in Urban Areas, and it's an EU-funded project to help communities prepare, respond, recover from flooding. It's very much focused on community resilience. That is, what can communities do themselves to help them prepare in a way that complements what statutory agencies do. Now, it's not just the British Red Cross involved in this. There's a whole range of partners, and I'll tell you a little bit about that now. So, British Red Cross is leading up the community resilience program part of this, which is going out to communities and doing workshops with people to help them prepare. Danish Red Cross and Hungarian Red Cross are also doing those workshops in their own area. The Danish Red Cross are also leading up a component which is looking at how agencies work together to improve what they do for communities. The Climate Centre is working with us, and they've developed a really great game which is sort of a way into talking about resilience with communities, so as you're not just starting off dry, that people are actually getting involved and playing a game that correlates to their experience. And finally, I'd like to tell you about the Psychosocial Centre. They have developed a fantastic model of psychological resilience specifically for flooding, and that will be ready to download in probably a couple of months along with everything else. So I would encourage you to do that, because I've had a look at the first draft of it and it's fantastic. So I want to tell you now a bit more about the workshops that we done, of which one element was psychosocial, but that's not all that we done. We done a series of workshops with different communities in which we tried to help build relationships between communities and agencies, so as agencies were communicating with communities consistently, and they were developing collaborative goals to help them be more resilient. We had a workshop where we helped communities analyse the risks that they were facing, but also what resources they had within their communities or could access to help them be more prepared. We created community emergency plans with each community, and we did also then deliver specific training programs on resilience, one of which is psychological resilience, which I will talk about quite soon. But first, what I would like to talk about a little bit is what we've seen when we actually went into the communities. Before we done any workshops, we went in and done needs assessments and that sort of thing, and talked with community members. And the first picture there, the top left picture, is a little street in a town called Ballymena, and there we met a fantastic lady who was really strong and drove forward community resilience in her area, but she was severely affected by the flooding herself. So what we've seen with this lady as an example was spiking anxiety. So she didn't have low-level anxiety all of the time, but when she's seen the clouds coming overhead, she would describe quite severe anxiety that she faced in that circumstance. She just did not want her house to flood again. She had been flooded 3 times before. She also described to us that she had had health problems since her most severe flooding situation, which she certainly ascribed to the stress. She also described how her community has fractured since the flooding. All those people who rented their homes just left because they didn't want to face that flooding again. And she also said that a lot of the older people, nearly all of the older people who lived there, had to move into homes after the flood because the stress had made them worse. The second picture is in a town called Antrim, and the lady who lives in this little house here has a stunning view of the river. We were there, and on a good day it's absolutely beautiful. There's birds and wildlife everywhere around her house, which for most of the time sounds lovely, but of course it floods quite easily. And this lady unfortunately had quite severe anxiety quite a lot of the time. Even when we were talking to her, even when she came to the workshops, you can see that she's anxious all the time, and she describes that as coming from when she flooded. She lost her family home, a home that had been with her family for over 100 years, I believe, due to the flooding. The damage that happened to the home and the damage that happened to her mother was too much stress for her to handle, and she very unfortunately had to give up that home just so she didn't have to deal with the stress anymore. The third picture is in a place called Muckamore, and what we found there was quite different. A gentleman who lived in one of those houses that you can see there, he didn't really have anxiety, but what he did describe to me was a loss of identity. So he was quite a strong man, quite a tough man his whole life, is the way he's seen himself. But when this flooding happened, he couldn't protect his family, he couldn't stop the flood water entering his house. So he lost that identity of being a protector. And this led him to become, as he said himself, quite angry and easy to anger. And he described to me some of the family difficulties that produced. So as you can see, some really quite severe repercussions from the flooding. So we were absolutely determined to do something for these people. And I had already been working in lots of projects on psychological resilience, and we'd done quite extensive research on what psychological resilience was. And we found a list of factors now that you can see on your screen. I'm going to try and do this lightly because it can get quite heavy. What we done was we just ruled out any factor that we knew we couldn't do anything about because there wasn't any point in thinking about it. That's that would be better for research, but we were applying. So the psychological factors that we tried to implement in our programs are listed on the left. They are optimism, and what that looked like in our context is community members being more confident after the workshops that they would be able to resist the flood waters entering their homes, or if it did enter their homes, that they would be able to cope with it better. We have hope, and if you look at the research on hope, what hope is about is how do we get from optimism, which is just the more positive thinking, to actually creating paths and strategies to make that happen. We have efficacy, both self-efficacy and the community. Very quickly, all that is okay, we're looking at the workshops, we're more optimistic now, but do we feel like we can actually implement this? So we really wanted to make sure that people felt that. Positive emotions, the research shows that if people are experiencing positive emotions around the difficulties that they're having, they're come out more resilient. And finally, on the psychological variables, we have meaning. And meaning is about people finding significance and purpose in the distressing flood events that they have been through. Okay, on the other side, we have social. And we have 3 factors here that we thought that we could help communities build. Number 1 is organisation. We wanted the communities to become more organised, because a more organised community is better able to implement the strategies that they would have developed during the workshops. We have social capital, which everyone will know what that is. We want everyone in the communities to be better connected to other people so as they can access emotional and practical support from each other. Building bonds. Now, this is a bit different from social capital. Social capital is the ability to access those resources. Building bonds is about having people identify with each other so that they want to help each other. So having identified these factors, we came up with a plan to implement this through two things. Embedding all of that in how we done things, and then also giving specific training. So, in terms of embedding, I'll try and do this quickly. Our whole program is broader than just giving a psychosocial training. But what we wanted to do is, in everything that we've done, we aim to make people feel more prepared, confident, and connected. So, in this way, even elements that weren't psychosocial were done in a way to affect people positively and build their resilience and well-being. So we really concentrated on the how we done our work. And we done this, number 1 is we wanted to evidence the approach so people would be confident that it works. And we've done that by bringing in members of other communities that had already done it. And they would open up the whole thing for us and sort of say, yeah, this works and this is how it's worked for us. We give the control of much of the process and of the goals of the whole process to the community members. It was theirs to do what they wanted. We supported, we facilitated, we gave lots of ideas, but they were able to shape it. We wanted to build active, enjoyable and practical workshops. Now, enjoyable is a strange word to use when you're talking about helping people prepare for flooding. It's not enjoyable maybe in the sense of being really happy, but it's enjoyable in the sense of they're doing things, they're in the flow, they're focused, they're planning, they're talking to other people. We wanted it to be practical, so as people were actually learning skills, applying them and seeing that they work, so as they would be confident that it would work when they needed it. We also built in early wins into the program. So our first workshop was to help people set up goals with statutory agencies. And what we've done was we've done an action list at the end of that workshop of what everyone was going to do. And everyone that we met really left that workshop feeling, for the first time, something's going to happen. We have a plan. And that was very deliberate, so as people were confident from the start. And of course, we built meaning and purpose into the workshop. Actually, we didn't really build it in. It happened as a consequence of the workshop, because community members were coming and they were learning they could not only just help themselves, but they were helping each other in the community. And I think that really gave people a sense of, they weren't happy that it had happened to them, but seeing as it did happen, they wanted to help other people from that experience. So, I'll try and quickly do this, the social part of how we embedded that. First of all, we wanted to connect people. We wanted to connect people with agencies, so as they were able to access the support that they should be able to access, because it's fine if the support is out there, but if you don't know what it is, how to get it, it's pretty much useless. So we wanted to do that. We also wanted to connect people with other people in the communities, and we've done that through the workshop. We tried to build a sense of place through using things like we brought a lot of old pictures to our workshops. We didn't reference them. We just had them up, and people were looking at them, looking at old pictures of where they lived, and that really, people started talking about it, and that really built a sort of sense of community. And we also used mapping exercises instead of just talking, so as people felt, oh, this is my community and I'm proud of it, and that helped people bond together. Also, our program is designed to be sustainable, so as that when we leave, the resilience doesn't stop, that the people there that we've left behind, the communities, have picked it up, taken the mantle, and now they're doing it. So that is how we embedded psychosocial in everything we done. Now I'm just going to take a couple of minutes to talk about some actual training on psychosocial that we done. So a few things that we done was we gave out handouts to everyone in the communities, not just the workshops, but in the communities that were at risk. We gave out handouts on how to be more resilient. We done a coping strategy exercise, which I'm going to show you in a second. We done a hopeful thinking exercise, which I will also show you in a minute. And we done relaxation training. We done an emotional awareness and diffusion techniques from ACT, acceptance and commitment therapy. And in the leadership training, which is not actually happened yet, what we will do is psychological first aid and active listening. Now, what we done in each workshop really depended on what we found at the workshop. So I would go to a community and start doing the workshop with them, do the coping strategies, and whatever sort of issues came up then, I thought, right, I think these people need, you know, relaxation training more, or they need to look at their thinking patterns more, and then I would just apply it. Okay. So here's an example of an exercise. This is super, super simple, but it actually gets very, very deep with people. So it's a coping strategies exercise, and I just ask people to gather in little groups and imagine that they had a really stressful day or week. I didn't ask them to think about the flooding because I didn't want to bring that level of distress to the workshop. I also didn't ask them how they cope, because I didn't want people just presenting positive things or things that they assume are coping strategies. I wanted to talk about the reactions that they normally have. Then, for every sort of strategy they came up with, we would have a discussion, and it was a discussion about whether they thought they were healthy coping strategies, you know, effective and had either neutral or beneficial health effects, or unhealthy, which is a strategy that didn't work or has short or long-term negative health effects. And we really talked these through, and at the end of that I would ask them to take what they learned, both in terms of healthy strategies they wanted to try and unhealthy strategies that they wanted to reduce, and put it into their little plan, which I had handed them out. So as they had an action plan, it wasn't just theoretical. This slide is just to show that I did reference them to extra help if they needed it, and showed them where they could access that extra help. So what I learned quickly from that exercise is, during the discussions, I didn't tell them what is healthy and unhealthy. I asked them questions about what they thought, and we discussed it. I think people will find it a bit condescending if I just went, no, that's unhealthy, stop doing that. Questions are often better than telling. I done it myself, and you can see that on the right hand side. Every time I went to community and we were talking about coping strategies, I would talk to them about my own coping strategies, as we all have difficulties, and that really opened them up. Quite often in the past you would hear psychologists say, don't do that, don't talk about yourself. I could not disagree more. When I started talking about myself, people thought, well, if he can, and he's leading this, I can. Now, I didn't make it about myself, that's a little bit different, but it really opened people up. We talked about a range of coping strategies, and I took the opportunity to use all the knowledge that I had on different aspects of psychology to give them ideas about what they could do. For example, on the right hand side you might see something called the gratitude journal, which is becoming quite famous now. And I do this every night. It's just writing down 3 great things that has happened to you. It could be big, could be small, during the day. And for me, when times are difficult, I found that helps put things into perspective. Yes, things are tough, but there's positive in every day. and I think people find that very useful. The final thing that I learned in this exercise is that just listening to people, active listening, is some of the best work you can do. Okay, nearly the end now. So the second exercise that I would sometimes do with community members is developing hopeful thinking. And everyone who's on this webinar will very likely know about the ABC model of how thoughts and actions are linked. Basically, the ABC model stands for adversity, which is just the event, the facts of it, no adding on of what you believe about it. Then comes the belief, that's the thoughts that you attach onto that. So say, the example I often use with people is whenever I go home, my house is a mess because my kids have messed it up. The facts are that there is mess. The beliefs I put onto it is that they're lazy, that they don't care, etc., etc. And we talk through all of that. And then the consequence, which is what you do as a consequence of the belief, but it's not a consequence of the event itself. And we go through some examples of that. And then I get people to apply it themselves. And we do this via a little thing called a ruminative spiral that you'll see on your screen now. And what we do is I ask them to think of an event that often produces stress for them, and I ask them to note it down. Now, if they were doing it fully, properly, they would do this table at number 4. But that's not what I asked them to do. I asked them just to note something down, and we talk more through the table than work through it. And then I ask them to write down all the thoughts that they have as a consequence of that event. And quite often our thoughts descend negatively. So you start thinking one thing, and then that leads to another negative thought, another negative thought, another negative thought. And we talk about that. And then I say to them, but that's not inevitable. You can, in fact, take that event and have positive thoughts about it. So if it's for me and it's the messy house, I can think, oh, this is wonderful. My children have not tidied the house up because they're so busy doing their schoolwork, or they're so busy out with their friends. I'm so glad that they have friends to play with. And in that way, we can create positive emotions rather than negative. Some of the tips that I do use for doing that is to challenge the negative thinking, to think of alternative explanations, to think of explanations that makes you feel better. And we talk through some other things. Sorry, I've skipped ahead there. Which is the body language and behaviours of someone who's thinking that thought, so that they can start to embody those thoughts. We also talk about whether those thoughts are realistic, because that's quite a common concern that people have. They, oh yeah, it's great to think that thought, but it's not realistic. So we talk about that. And then we talk about, okay, so you're saying it's not realistic, but is it productive? What would happen if you took this thought, if you made it your own, and your behaviour changed as a consequence for the better? Would you get a better outcome from that than maybe a more realistic negative thought? And it's not always yes is the answer to that, but quite often it is. And quite often when I've been talking through that with people, for example, the gentleman who was talking about, who lost his identity of protector, I don't know, I'm going to see him shortly, but we really talked through his anger. And he was very excited to start applying some of these positive thinking techniques, and was very confident that would make him act in a way that was more in accordance to how he really wanted to act. So you can see that I do this myself for people too. I don't make them do it and just stand back. There's mine. That's the one we're talking about, the messy house. And you can see my wee smiley faces and angry faces. That's my emotions. So what did I learn from this? When we're applying psychosocial in the real world, you have to be flexible and responsive to what you find. You can't just go in determined that you're going to do something, and if it's not fitting, not try and change it. It can be quite difficult, but with practice you get it. These big ideas that we're talking about in terms of resilience, they matter to us as practitioners or researchers. They don't matter to people who is experiencing it. So you have to make it very real for them. Talk about actual thoughts that they're having, actual problems that they're having, the way they're living their lives, the way they want to live their lives, rather than quite highbrow. And I've already said, share your own story helps, as long as you don't make it about you. Oh yes, and questions are always better than answers. I very rarely give advice. Can't even think of the time I have given advice, but I certainly question people and bring them through the process so they're changing it in the way that they want to, not in the way that I think they should. So that is the end of my little portion. If you could take 3 things away from what I've talked about, it would be these. It's not just what you do. You see that I had psychosocial training and that it's really helped people, but it's not just that it's people's well-being. It's how you do everything. Every time you come in contact with the community, every workshop you give, you have the opportunity to build people's efficacy and positive emotions and meaning, even if you're not talking about those issues. More than anything, all the people that we met with wanted more than anything else was just really listened to and understood. And I think that probably done a good 60-70% of the work. And finally, what I tried to do in my workshops was not just to listen to people and make them feel better at that time, but to give them skills that they could use for the rest of their lives, whether it's to do with flooding or anything in their lives. And we really believe that's what we achieved. And thank you very much for listening to that. And I think we're going to have questions soon. Thank you.